Women and breast cancer. Cancer is a word we do not like to hear. It inspires fear and uncertainty. According to the National Cancer Institute, cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other parts of the body through the blood and lymphatic system. These abnormal cells are created when the genetic material, DNA, becomes damaged or changed, producing mutations that affect normal cell growth and division. When this happens, cells do not die when they should, and new cells form when the body does not need them. The extra cells may form a mass of tissue called a tumor. Today I will be discussing the one type of cancer the American Cancer Society recognizes as the most common cancer among American women, breast cancer. In this speech, I will be talking about understanding breast cancer, risk factors and prevention, early detection and screening. For some women, the words breast cancer are synonym of race for the cure, pink merchandise. Some think of a family member and some are survivors themselves. According to the Susan G. Komen Foundation, breast cancer is a type of cancer where the abnormal cells divide and grow either in the mammary ducts or in the lobules. Tumors in the breast tend to grow slowly. By the time a lump is large enough to feel, it may have been growing for as long as 10 years. However, some tumors can be aggressive and grow much more rapidly. The types of breast cancer the Komen Foundation describes are invasive and non-invasive. Invasive breast cancer occurs when abnormal cells from inside the lobules or ducts break out into nearby breast tissue. This allowed the cancer cells to spread to the lymph nodes and in advanced stages to organs like liver, lungs, and bones in a process called metastasis. Cancer cells can also travel from the breast through the lymphatic system and the blood early in the process when the tumor is small. Non-invasive breast cancer is when abnormal cells have not spread to nearby tissue or beyond. The condition is called in situ. The term in situ means in place. Although the abnormal cells have not spread to tissues outside the ducts, they can develop into invasive cancer. Now we can understand what breast cancer is, but who gets it? When we hear someone has been diagnosed with breast cancer, it's natural to wonder what may have caused the disease, but no one knows the exact causes of breast cancer. Doctors seldom know why one woman develops breast cancer and why others don't. Studies from the National Cancer Institute have found the following risk factors for breast cancer. Age. The chance of getting breast cancer increases as you get older. Most women are over 60 years old when they are diagnosed. Having breast cancer in one breast increases your risk of getting cancer in your other breast. Your risk of breast cancer is higher if your mother, father, sister, or daughter had breast cancer. The risk is even higher if your family member had breast cancer before age 50. Women who have radiation therapy to the chest, including the breast, before age 30. The older a woman is when she has her first child. Women who never had children. Women who had their first menstrual period before age 12. Women who went through menopause after age 55. Women who take menopausal hormone therapy for many years. In the United States, breast cancer is diagnosed more often in white women than in African American, Hispanic, Asian, or American Indian women. Being overweight or obese after menopause, lack of physical activity, drinking alcohol. Many other possible risk factors have been studied. For example, researchers are studying whether women who have a diet high in fat or are exposed to certain substances in the environment have an increased risk of breast cancer. Researchers continue to study this and other possible risk factors. Now, can we prevent breast cancer? The American Cancer Society says there is no sure way to prevent breast cancer, but there are things all women can do that might reduce their risk and help increase the odds that if breast cancer does occur, it is found at an early, more treatable stage. The American Cancer Society also notes that early breast cancer usually doesn't cause symptoms, but as the tumor grows, it can change how the breast looks or feels. The common changes include a lump or thickening in the near of the breast or in the underarm area, a change in the size or shape of the breast, dimpling or puckering in the skin of the breast, a nipple turned inward into the breast, discharge fluid from the nipple, especially if it's bloody, scaly, red, or swollen skin on the breast, nipple, or areola, the dark area, the skin in the center of the breast. The skin may have ridges or pitting so that it looks like the skin of an orange. If you have any of these symptoms, you should tell your healthcare provider so that the problems can be diagnosed and treated. The Susan G. Komen Foundation recommends that women have regular clinical breast exams and mammograms to find breast cancer early. Treatment is more likely to work well when breast cancer is detected early. No woman should take breast cancer lightly. It could happen to any of us. In my family, my mother was the first person to be diagnosed with breast cancer. Every woman should be aware of the risk factors we mentioned, as well as the screening methods, and make them part of their life. The American Cancer Society published the following statistics for this year. In the United States, 1 out of 3 cancer diagnoses in women are for breast cancer. About 207,090 new cases of invasive breast cancer will occur in 2010, and 54,010 will be diagnosed with non-invasive breast cancer. About 39,840 women will die from it. Early detection tests for breast cancer save many thousands of lives each year, and that many more lives could be saved if even more women would evaluate the risk factors and take action on the detection methods explained.